Fainting, medically known as syncope, is a common and often alarming experience that involves a temporary loss of consciousness. It's a sudden and brief blackout that typically occurs when there's not enough blood flow to the brain. When someone faints, they usually collapse to the ground and remain unconscious for a short period, typically lasting from a few seconds to a few minutes. Upon regaining consciousness, the person might feel confused, dizzy, or weak. While fainting can be scary for both the person experiencing it and those around them, it's usually not a sign of a serious underlying condition. However, in some cases, it can indicate a more significant health issue that requires medical attention. It's important to note that fainting is different from other causes of loss of consciousness, such as seizures or concussions, although it can sometimes be mistaken for these conditions. So, how common is fainting? Well, fainting is surprisingly common. It's estimated that about 1/3 of people will experience at least one fainting episode in their lifetime. The likelihood of fainting increases with age, and it's more common in certain groups, such as pregnant women or people with certain medical conditions. While fainting can occur at any age, it's particularly common in teenagers and older adults. Causes of fainting. The causes of fainting are diverse and can range from harmless to potentially life-threatening. The most common cause is vasovagal syncope, which is a type of fainting that occurs when your body overreacts to certain triggers. These triggers can stimulate the vagus nerve, leading to a sudden drop in heart rate and blood pressure. This causes a temporary reduction in blood flow to the brain, resulting in fainting. Common triggers for vasovagal syncope include emotional stress, the sight of blood, prolonged standing, and overheating. Some people are more prone to this type of fainting due to genetic factors or other predisposing conditions. Dehydration is another common cause, particularly in situations where the body loses more fluids than it takes in. This could occur during periods of intense exercise, hot weather, or illness. When the body is dehydrated, blood volume decreases, making it harder for the heart to maintain adequate blood flow to the brain, which can trigger fainting. Fainting can also result from standing up too quickly after sitting or lying down for a prolonged period. This is known as postural or orthostatic hypotension and occurs when the body is unable to adjust to the sudden change in position. Gravity causes blood to pool in the legs, and if the blood vessels don't constrict quickly enough to compensate, blood pressure drops and fainting can occur. When fainting is caused by a heart condition, it is usually due to a problem with the heart's ability to pump blood effectively. This could be due to arrhythmias, where the heart beats irregularly, or structural problems like valve disorders or heart muscle weakness. In these cases, fainting can be a warning sign of a more serious heart condition that requires immediate medical evaluation. Symptoms of fainting. The symptoms leading up to a fainting episode, known as presyncope, can be quite distinctive. Many people experience a group of sensations that serve as a warning that they're about to faint. These symptoms include lightheadedness, dizziness, or tunnel vision. Some people may experience sweating, nausea, or ringing in the ears before they lose consciousness. These symptoms typically develop over a few seconds to a few minutes before fainting occurs. Some people describe feeling as if the room is spinning or that sounds seem distant. There might also be a sensation of the heart racing or pounding. The experience of fainting itself is often described as a sudden lights-out moment. Most people have no memory of the period when they're unconscious. Upon regaining consciousness, which usually happens within a minute or two, people often feel confused and disoriented. They might have a headache, feel weak or shaky, and experience lingering dizziness. Some people also feel nauseated or may vomit after fainting. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of fainting. When someone presents to a healthcare provider after a fainting episode, the first step is usually a detailed discussion about the circumstances surrounding the event. The doctor will want to know about any symptoms leading up to the fainting, how long the person was unconscious, and how they felt afterward. They'll also ask about any medications the person is taking, their overall health history, and whether there's a family history of fainting or heart problems. A physical examination typically follows, including checking vital signs like blood pressure and heart rate. The doctor might check blood pressure and heart rate while the patient is lying down, sitting, and standing to look for postural changes. They'll listen to the heart and lungs and may perform a neurological exam. Depending on the suspected cause and the patient's risk factors, various tests might be ordered. These can include an electrocardiogram to record the electrical activity of the heart and detect arrhythmias or other heart problems. An echocardiogram, which is an ultrasound of the heart, can reveal structural issues or problems with heart valves. In some cases, a tilt table test may be used to diagnose fainting. This involves strapping the patient to a table that is tilted at different angles to see how the body responds to changes in position. This test is particularly useful for diagnosing vasovagal syncope or orthostatic hypotension. Blood tests may also be performed to check for underlying conditions like anemia, dehydration, or electrolyte imbalances that could contribute to fainting. Treatment for fainting. In many cases, no specific treatment is needed, especially if the fainting is due to a temporary trigger like dehydration or stress. However, it is important to avoid triggers and learn some techniques to avoid fainting episodes in the future. These might include recognizing warning signs and immediately lying down or sitting with the head between the knees, staying well hydrated and avoiding prolonged standing. Other helpful techniques include wearing compression stockings to improve blood flow from the legs and learning counter-pressure maneuvers, like clenching the thighs or crossing the legs, to temporarily increase blood pressure. In some cases, medications might be prescribed to help prevent fainting. These could include drugs to increase blood volume or to regulate heart rate and blood pressure. As for postural syncope, which happens when changing to a standing position, you may need to make some lifestyle changes, such as rising slowly from a sitting or lying position and always making sure that you stay hydrated. When fainting is due to a cardiac cause, treatment focuses on addressing the underlying heart condition. This might involve medications to control arrhythmias, procedures to correct structural heart problems, or in some cases, implanting a pacemaker or defibrillator. It's important to note that while fainting itself is usually not dangerous, the fall that often accompanies fainting can lead to injuries. Therefore, part of managing fainting involves teaching patients how to recognize warning signs and take steps to prevent falls. In most cases, especially for vasovagal syncope, the prognosis is good. Many people experience only occasional fainting episodes that don't significantly impact their quality of life. Now, we want to hear from you. Have you ever fainted before, or do you know someone who has? What did you feel right before it happened? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.